Thank you for coming today. Today, we're going to do the Menopause Master Class, symptoms, solutions, and what every woman should know. I think menopause and perimenopause education is so important. It most recently came to light when my cousin was like, "What were grandma's symptoms of menopause? What were our mom's symptoms of menopause?" And I said, they didn't talk about them, so we don't know. I think it's really important now that there's so many new research studies coming out. The Women's Health Initiative study had kind of put a bad light on synthetic hormones. And now there's a lot more research going into hormone therapy and how it can help women in the later stages of life. Our topics are the definition of menopause, understand what menopause is and why it happens, the stages that you'll experience menopause, the symptoms, what are the common symptoms, and when to seek medical care, and solutions. Different little tidbits we are starting to learn about so you can make some informed decisions on either treatment, supplements, diet, exercise, those sort of things. Menopause is basically the cessation of a menstrual period, and that's the actual term for it. It's when you don't have a period for 12 consecutive months. Towards the end of losing your period, you might go 5 months without a period and then it starts again. Well, that's your timer starting again. We can't say one period in 12 months is menopause. That's not considered actual menopause. So we would say that after that 5 months and then you start again, that's when the timer starts again. If then it's 6 months, that's when your timer starts. And then you have to go 12 months after that. So it's 12 consecutive months, 12 back-to-back months without a period that's considered menopause. The average age is around 51 years old. Average means that it could be much longer or it could be much shorter than that. And then of course we also know that there's people who have had their uteruses removed, so that would be a specific type of menopause. Menopause is not the end of vitality, it's a natural transition to a new stage of life. With the right knowledge, support, and care, women can continue to live healthy, active, and fulfilling lives. Menopause happens because the ovaries gradually slow down and produce less estrogen and progesterone because we're not having children anymore. As these hormones decrease, periods become irregular and eventually stop, marking the natural transition to a new stage of life. Funny enough, I remember growing up as one of the ways I knew menopause was when probably men would refer to it as the change. If a woman was having hot flashes or she was older and not having children, that I remember that being referred to as a change. 3 stages of menopause include perimenopause, which is before or around actual menopause, and then postmenopause. Perimenopause is when our hormones begin fluctuating. This can happen even in the late 30s, and periods become irregular and we have different symptoms. We might have symptoms of itchy ears, frozen shoulder. Things start to become drier because we do have estrogen receptors everywhere in our body. So when things become itchier or drier, we notice that sometimes those are decreases in estrogen production. Actual menopause is, again, no menstrual period for 12 months. And then postmenopause is when our hormones remain low and we continue to have symptoms. A lot of times I know that women it becomes their new norm, and that's just what they have to suffer through. Common symptoms of menopause. We've answered a few, and there's certainly a few well-known ones. The vasomotor ones is you can see someone grabbing a fan even when it's cold outside. We have our really cool fans that we got made. So vasomotor symptoms like that, but it's also fatigue, mood swings, anxiety, a lot of waking up at night with heart palpitations. That could actually be a sign of menopause. Weight gain, especially around the belly area, bone loss. We're finding out that sometimes osteoporosis or osteopenia is being caused by different factors that are hormonal, low libido, urinary issues, UTIs. In the elderly, there's been a lot of studies on that and how menopause and low estrogen has affected the instance of UTIs. High cholesterol, high blood pressure, vaginal dryness and atrophy. I say this to a lot of women. Did you know that your labia gets smaller with age? And a lot of people don't know it because I do think that it's something that we haven't talked about. Our moms haven't talked about, our grandmas haven't talked about. we just put up with it. We're in such an exciting time in medicine where we're doing more studies on women and more studies on these symptoms. And we are starting to find that these can, hopefully some of these medications, these bioidentical hormones, supplementing them can help us live longer, decrease our instance of heart attack, of losing our bones, a lot of different ways it can help us. We don't always push medication. The best things, the most standard things, we always say diet, exercise, and sleep affect so much of your life. Eating a balanced, nutrient-rich diet, staying hydrated, staying active, moving around. We're not talking about running miles every day, just basic strength training, keeping your muscles nice and working is really going to benefit you later in life. I always say that I don't work out now to look good. I work out now so I can lift things off the floor, my grandchildren in the future, and avoiding smoking and limiting alcohol intake. I've said this before, but I think it will reign true that alcohol is going to be known as the cigarettes of our generation. In 20, 30 years, I don't think a lot of people would be drinking alcohol. And I think more will come to light of how bad it actually is for us. I just don't feel good after I drink. The older I get, I do not feel good. So it's easy to not partake. And also, I feel like the GLP-1s help take that wanting to drink alcohol away as well. Enough sleep and proper rest are so important. It's just a foundation for health all around. One of the questions I always ask people is how they sleep. If you're not sleeping good, you cannot build from a good foundation. So having good sleep habits where we're not going to sleep with the TV, we're not looking at our phone an hour before bed, we're getting 8 solid hours. Those are really important. And to talk about that, a lot of the issues with hormones will wake us up at night and interrupt our sleep. There's different bioidentical hormones will help sometimes with sleep. And then one of the medications that we often prescribe is progesterone that also causes some sedation and helps with sleep anxiety. So a lot of our ladies are able to sleep better. And then stress management and being happy, which hormone relief can sometimes help with that as well. So we'll go over different treatment options. Preventative care is always important. Routine health screenings and annual checkups, keeping up with your doctor or your provider. There's some non-hormonal treatments, vaginal moisturizers or pelvic floor therapy, or even just exercise in general will help you. We didn't list it on here, but meditation, yoga. Supplements include vitamin D, calcium, magnesium, omega-3 protein. I also like magnesium. I love supplementing with magnesium, especially at night. And then hormone replacement therapy. We use bioidentical hormones. They naturally mimic what your body already makes. Hormone therapy is important because it's the most effective treatment for relieving bothersome menopause symptoms and also with maintaining quality of life. A lot of women just think that this is how they have to live in their later years of life. And it's simply not true. We have so many more modalities to help treat women now. We'd love to help you talk about that decision. We offer very personalized, individualized care. In Oklahoma, we offer pellets. If you're local and want to come to our office, it's a physical procedure that involves, it's almost painless. We use lidocaine. And then for our other states, we offer creams, injections, patches. There's different modalities in which we can deliver bioidentical hormones. With that, I wanted to see if anybody had any questions today.
We have a few questions coming from social media. One involves safety concerns, and our prospective patient is asking, my mom has told me that hormone replacement therapy causes breast cancer and heart attacks. Has the medical advice changed on HRT and hormone therapy where those are concerned?
So that's a really good question. And there's more and more data coming out. I think what she's referring to is some older data that we used to have, and we thought that replacing these hormones was causing blood clots, thus causing heart attacks and stroke. Well, they were studying synthesized hormones, not bioidentical hormones. Recently, the FDA changed some of their guidance on that, and we're opening up a lot more testing on bioidentical hormones. And we're finding out that while we can't conclusively say, I'd have to look up the exact study for that, starting hormones younger will help hopefully prevent some of these things.
We've got another one that is regarding two specific symptoms, hot flashes and night sweats. And our viewer is asking, what are the most effective non-hormonal solutions that she can do naturally at home for hot flashes and night sweats?
Most effective non-hormonal solutions for hot flashes and night sweats. The first thing that comes to mind would be there's a natural supplement, Ohash, which is a good supplement for night flashes and hot sweats. Definitely talk to your doctor before you start that. Definitely talk to them because there are some contraindications for starting black cohosh. And then also, if we treat with estrogen, which is a hormone, estrogen will help treat those vasomotor symptoms of hot flashes and night sweats, but that is hormonal.
We've got a question coming from TikTok. Our follower is asking, I have gained weight around my midsection. Why does what worked in my 30s stop working now?
That's a good question.
And she says she hasn't changed her diet or exercise routine.
Certainly, there is definitely a hormonal aspect involved in that, but there's also something to be said of some insulin resistance. The food that we eat every day, we might have been able to maintain certain ways of eating or it didn't affect us, but we live in a country where we have ultra processed foods. Our insulin resistance tends to make us gain weight around our midsection. Also, that loss of estrogen as well, the loss of estrogen is going to make us gain weight around our midsection. It seems like it becomes harder and harder the older we get, but a lot of times starting hormone therapy will help with that. Also, do GLP-1s that also help with that as well.
We've got another question coming in from social media, and I personally want to know this one as well. Is brain fog from menopause reversible? Will this ever go away?
I'm going to have to look up the exact studies. I'm perimenopausal, so I haven't started all the hormone therapies. But what's funny is that my friends and my kids have started to help me find words. And then when I'm around menopausal or perimenopausal friends, we can help each other finish sentences. But if you ask me the words of a song, I can certainly sometimes say the lyrics to a whole song. So I do think it's reversible. I think that getting more sleep, getting better quality of sleep, and having your hormones balanced can help with that. I'm going to have to look at the exact studies, but I do think personally what we've seen in patients is it does help with brain fog. Brain frog.
There's one right now.
There you go.
How long does perimenopause usually last?
It's really different for everybody. So perimenopause could be 10 years. It's just a group of symptoms. And sometimes some of your lab levels will be low, particularly testosterone, but it's just a group of symptoms. So it can last several years, up to 10 years. And then we don't go into menopause until we actually have a cessation of a menstrual cycle. Judge, I don't know what the average is, but I can find that out.
Can you still get pregnant during perimenopause?
Yes, you can because you are still ovulating if you have a uterus and tubes.
Is there a specific reason why women are waking up at odd times during the night, 3 a.m.,
I
4:30?
think it has to do with the imbalance in our hormones and how it affects the circadian rhythm. It could also be due to the symptoms. So you're going to be waking up if your ears are itchy. You're going to be waking up if your feet are itchy. If you have heart palpitations, you're going to be waking up.
Anxiety gets me.
Yes. Progesterone really helps a lot of patients with that. It helps with sleeping and anxiety relief as well.
Should I ask my doctor for a blood test to check my hormone levels to confirm if I'm in perimenopause?
That's a good question, actually. So you could, but the problem with that is that your hormones are going to be different levels depending on which phase of cycle you're in and what time of day. Why we always see that labs are normal because they are going to fall into this normal range. But just because they are normal doesn't mean that things aren't declining. So that's what we found out is that we should be treating hormones based more off of symptomatic relief.
How do we know when the difference between being in perimenopause and being just stressed out as moms, wives?
It might be age. It might be age and the symptoms. So it could be that you're 35 and yes, you're stressed out, and it is possible that you might be in perimenopause based on some of your symptoms. But that could be just the very beginning of some overlapping of some perimenopause symptoms as well. So there could be a few things working in that way.
Menopause cause hair thinning and skin changes.
Yes. So we have estrogen receptors everywhere, and definitely the skin changes, definitely the hair thinning. That's also why we'll see a lot of itching as well, because we have estrogen receptors everywhere in our bodies, skin, hair, everywhere. And with that decrease in estrogen, it changes your skin, it changes your hair.
Sex and sex drive. Is it permanent and can it be restored?
It can totally be restored, because when I say the estrogen receptors are everywhere, they're everywhere. Even on our
Right.
skin down there, the vaginal dryness, atrophy, where our labia gets smaller. There was a new study that came out about preventing UTIs in elderly females, and we found that prescribing vaginal estrogen is also helping prevent these UTIs and then helping prevent people from having sepsis and death from UTIs. I don't think that they've come out with a recommendation that every elderly woman should have vaginal estrogen, but I could totally see that coming soon, because not a lot of vaginal estrogen is absorbed in the bloodstream to make your levels really change any of the levels. It's more of a targeted approach. Vaginal estrogen can help that uncomfortable sex, vaginal dryness. And there's a few ways that you can get vaginal estrogen. So you can get it as a cream where you just put it over the labia. You can also get it as an insert where you put it into the vagina. It depends on how you would like it, if it's too messy, those sort of things.
In your professional experience and having provided hormone replacement therapy, what is just maybe one or two just general pieces of advice that you can give the woman that is curious if she's going through menopause, or maybe short-term relief until she can get her appointment? What can you recommend?
I just think that the most exciting thing is that we are talking about it and we are treating it, and that your symptoms are not crazy. It's an exciting time to be alive, to be able to experience this. I often think about my grandma and I wish that she would have had the experience to get hormone therapy. I feel like that would have added to her quality of life in so many different ways, mentally and physically. I would just say be patient, do your research, that we have solutions. If it was something, some sort of case that we wouldn't be able to deal with, we pride ourselves in finding someone that if we can't help you, we will always find a way to help you. Hormones aren't for everybody, as far as like there's some contraindications, as far as different types of cancer would probably disclude you unless you were able to talk to your oncologist and come to that conclusion that if you had a hormone positive breast cancer. But those are also ways in which I think that we try to practice differently, where we really talk about quality of life and the different options, and we weigh those and we make those personalized decisions with patients.
It is exciting.
Yeah, it is exciting.